Hi, I'm Matt Singh, and I'm the Associate Program Director for the Spectrum Health Michigan State Emergency Medicine Program. I want to thank you for your interest in our program and show you what makes our program unique. Our philosophy is to not only focus on your clinical education, but to focus on you as a person, your wellness, and your professional development. We have dedicated faculty members who are heavily involved in your education and have different areas of expertise. And we all wanted to show you why the experience here in Grand Rapids is special. When you look at our resident schedules, you will see a lot of emergency medicine time. That's because we believe there's no better place for you to learn than in our adult and pediatric departments. We are a tertiary referral center with over 160,000 visits per year. We have a large catchment area with patients coming from downtown Grand Rapids to remote parts of Michigan. With this comes a lot of acuity, a lot of volume, and a lot of pathology. You'll be exposed to it all and take the lead on 6 patients. With this experience, you'll be ready for any patient who comes through your door after graduation. Our residents work a maximum of 18 to 20 shifts per EM block. You'll have heavy exposure to things like toxicology, ultrasound, EMS, and teaching opportunities. You'll spend 4 months rotating between our pediatric, surgical, and medical ICU. One unique thing about our program is our longitudinal scheduling. Every month, you'll have dedicated pediatric shifts at our children's hospital, and every single day you'll be exposed to trauma and critical care. If you have an area of interest or interest in a fellowship, we can tailor your curriculum to meet those needs and give you even more of a longitudinal experience. While our residents work very hard, through strategic scheduling, we can also give you time to do the things you like to do outside of work. And you'll also have 4 weeks of paid vacation per year.
Helen DeVos Children's Hospital is the only level 1 children's hospital on the west side of Michigan. Therefore, we have a large catchment area of rural, suburban, and urban areas, and we have many pediatric subspecialists. Our PZM curriculum is unique. Our interns will staff our urgent care or our fast track module, as well as our higher acuity module. Our senior residents will mainly staff the higher acuity module to maximize their experience, but they will be able to staff the lower acuity module if they so desire. Most importantly, our EM residents are our primary residents. You will not be a visitor in our department. This will be part of your home.
I think one of the strengths of this program is the access to point-of-care bedside ultrasound teaching. We cover important topics such as EFAST, echo, aorta, renal, and gallbladder studies, as well as OB, and we teach a comprehensive evaluation of a critically ill hypotensive patient. Throughout your residency, you will receive ample bedside teaching, ensuring that you'll be completely comfortable with this skill that will change your medical management in real time. Both Mariah Barnes and myself are ultrasound fellowship trained, and we'll make sure you have both the skills and the comfort to use this tool to success in your future.
Here in Grand Rapids, you'll work at both Spectrum Health Butterworth Hospital and Helen DeVos Children's Hospital, which are state-designated Level 1 adult and pediatric trauma centers. Our residents are involved in all trauma activations, whether it's blunt or penetrating, adult or pediatric, direct scene call from our helicopter, or transfer from an outlying rural hospital. You'll be exposed to a variety of traumatic presentations. In the department, our residents have exclusive airway management access and perform bedside EFAST examinations on all of the trauma patients. You'll also spend 2 months outside of the department rotating on the trauma service, which is just enough time to develop procedural competency and get to know your trauma colleagues without spending too much time outside of the department.
We have protected time every Thursday morning for our weekly didactics. This is a time for you to work with your fellow residents, your core faculty, and other experts in emergency medicine. We're constantly thinking of new ways to make our didactics more engaging and interactive. Most weeks we have time dedicated to grand rounds, practicing board review, utilizing foundations of emergency medicine for case-based learning, and learning from the incredible specialists at our growing institution. Our didactics are unique because we not only focus on your clinical education, but we focus on current healthcare policies, your wellness, and career development through a new business and medicine curriculum.
Our simulation program allows residents to participate in simulation in a challenging but safe environment. The residents will work in small groups to better improve their communication and leadership skills. Aviation is one of my passions outside of the emergency department. Being a private pilot allows me to spend time with my family in the air. Throughout the years, I've logged many hours in flight simulators. I believe my experience in these simulators have made me and continue to make me a more proficient pilot. I believe the same experience in medical simulation will make you a more proficient emergency medicine physician.
As a faculty member, one of my roles is to organize our monthly procedure lab for the residents. It's a chance for them to practice both the rare and the common procedures that we do in our specialty. So each lab we break down into small groups and rotate through several stations where a faculty member will walk you through step by step how to do a procedure. They'll give you tips and feedback as you practice on mannequins and simulators. It's a great way to get your hands on the equipment and to develop the muscle memory that you'll need to do these procedures. We cover everything from central lines to cricothyrotomy, even slit length exam. And by the end of your time training with us, you'll feel comfortable with all of these. Our procedure lab is just one of the ways we'll make sure you get there.
Our residents are heavily involved in scholarly activities. Last year alone, we had over 110 scholarly projects completed, including abstracts, publications, and national presentations. We have protected time for all of our second years to each complete a publication and present at our local research day. All of our second years attend SIEM, and all of our third years attend ASAP. You will be financially supported to complete research projects and present at other national conferences through dedicated research funds.
As chair of the Department of Emergency Medicine at MSU CHM, I think there are many opportunities for our residents to be engaged in both teaching and scholarship via the department. In fact, we have many medical students rotating through the ED, since every second-year medical student at CHM is required to rotate in the emergency department as part of their introduction to clinical medicine. In addition, of course, we have the third and fourth year elective rotations that students take, and the close affiliation allows our residents to engage with some of our research faculty, which provides another venue for scholarship.
In addition to being a core faculty member, I'm also the medical director for our county EMS system. Our resident experience includes ride-alongs. We ride along with fire departments and our ambulance agencies, so both transport and non-transport EMS. We have the option of flying along with our aeromedical service, AeroMed. We have a didactic program of lectures. I think our residents really enjoy when we review and listen to audio recordings of online medical control, helping prepare them for when an online medical control physician isn't attending. For those residents who decide that EMS is a passion, we've had 4 residents apply to EMS fellowship in the last 10 years. I'm always happy to tailor a specific program to meet their needs.
The well-being of our residents is of the utmost importance to our program. So we've developed a wellness curriculum aimed at supporting our residents physically, emotionally, and spiritually. We offer lecture-based education on topics like sleep hygiene, dealing with stress, work-life balance, preventing burnout, and life after residency. We also meet in small peer groups to debrief challenging cases. Counseling services are provided anonymously and free of charge, and all residents are encouraged and empowered to use them. We've identified mentorship as a key to supporting our residents. So each incoming intern is placed in a mentorship family, which allows them to develop support systems and friendships. And lastly, we believe that spending time with each other outside of the ED promotes wellness and cohesiveness. We build community while on retreat, by volunteering, at the gym, on hikes, in the bar, and in each other's backyards.
Resident wellness is one of our top priorities, and we know that a strong support system, both in the ED and outside of the hospital, is vital to that, which is why we support and encourage family-friendly gatherings, group dinners, organized club sports, and our resident favorite, the yearly retreats. Once in the summer at a beautiful spot on Lake Michigan, and once in the winter at an amazing lodge in the woods, you'll have protected time away from the ED to relax, enjoy, and decompress with your fellow residents.
I hope that gives you an idea about what makes our program special. We have a lot more to share with you on interview day, and we look forward to meeting you.